Hello, my name is Raquel Crumbach. This is for my clinical reflection one. I'm going over new skills, knowledge, or perspectives that I learned during this experience. There was a lot, but one that definitely stuck out to me was the Z-Track method. This is a skill we learned that's used for IM injections, and it includes displacing the skin, then injecting the medication to help prevent the medication from coming back out. Um, Professor Mullen showed me a good way to displace the skin when giving an IM injection. You can go from around behind the arm and kind of pull the skin out to the side, and that will create that Z-Track method. Three aspects of safety and the importance of these in simulation and clinical. One would definitely be recapping the needles using the one-handed scoop method. This is important to prevent needle stick injuries. It's imperative in both simulation and clinical for the nurse to remain safe and to be able to continue to do their job. Another safety aspect would be using the method of the 3 checks when administering medication. This is important in simulation to practice like you play, and it's imperative in clinical setting to decrease the chance of medication errors. Documentation could be another safety consideration. If you didn't document it, it didn't happen. Documentation is important for communication of what is going on with a client and what interventions have been done. This could cause a safety issue if you give a medication and don't document, and then the next nurse to care for the client thinks the medication hasn't been given yet, which it could lead to that nurse providing the medication, and then that could be a medication error and possibly drug toxicity. New skills and knowledge that will assist me in providing safe care for my clients. I will implement the Z-Track to ensure adequate administration of medication. I'll recap my needles the proper way to avoid needle sticks. I'll check the rights of the medication 3 times before administering to decrease medication errors, and will ensure to document immediately after any intervention. I will utilize the principles of medical and surgical asepsis for any procedure that requires it, such as inserting a Foley catheter. In lab, we reviewed how to maintain a sterile field and how to put on sterile gloves. This contributes to infection control in caring for clients by ensuring the nurse remains sterile and keeps a sterile field to reduce the risk of infection for the client. As far as techniques to assist with moving, transferring, or ambulating clients, we didn't go over these or practice them in the lab, but based on the readings, I will ensure to lift with my legs, not my back. I'll grab help to move a client when necessary and ensure the proper devices are used to transfer and ambulate clients. These techniques will contribute to client safety by decreasing the risk of falls and falls that will result in injuries with the use of the proper devices and the proper knowledge of how to use each device. Overall, our last few weeks have been great in lab, and I look forward to starting clinicals soon. So that is it for my clinical reflection one. Thank you.